This is a hip hike using a block for pelvic control as well as strengthening of the QL and the glute medius. So we're going to take a block. So I have a foam block here. If you have a cork block, I would recommend using a cork block. You can also stack up some books. So you're going to start standing on top of the block with the opposite leg just floating and hovering. And then bring your hands to your hips so you can feel where your pelvis is. And I like to feel for the ASIS, so those frontal hip bones that you can feel, those prominent bones here. And then just a micro bend in the standing leg just so we're not locking out, but we're going to keep that same micro bend throughout. So standing up nice and tall, keeping the leg in this same position, you're going to slowly lower that right heel towards the floor, and so you'll feel the pelvis drop on that right side. And then pressing into this standing leg, you're going to try and hike that right side all the way up. The leg stays straight. So we're going to slowly lower that hip down, and you can see how my hands kind of shift with the pelvis, reaching for the floor, and then driving that leg straight up. And notice I'm not kicking the leg out to the side. I'm keeping it in line with the hips, okay, lowering that heel towards the floor, and then hiking that hip up. So when we are hiking that hip up, we're actually using our QL. That QL is contracting. Part of that work of the QL is lateral flexion or hip hiking. And so we're essentially doing lateral flexion, but with a different sort of control here. And then this standing leg, this glute medius on the standing leg, is doing the work to stabilize us. So lowering down and then lifting back up with control and without moving your torso with that. So you're trying to keep your torso steady, just working from the lower spine and the pelvis. You should really feel that stabilizing hip.